Hello friends, let us now learn some important points about the treatment of vomitings. So vomiting treatment we have acetylcholine, H1 and 5-HT3 and D2. All these will activate chemoreceptor trigger zone and thus they can be used in nausea and vomiting. Then we have acetylcholine blockers. Acetylcholine blockers like hyoscine and scopolamine are used as drug of choice for motion and primary mountain sickness. They are used as drug of choice for motion and primary mountain sickness, hyoscine and scopolamine. Then we have H1 blockers which include doxylamine. This doxylamine is used as drug of choice in morning sickness, and this doxylamine is actually safest in pregnancy. This doxylamine is used as drug of choice in morning sickness and safest in pregnancy. 5-HT3 blockers include ondansetron, granisetron and dolasetron. This ondansetron, right. Then we also have polanasetron. Ondansetron has short half-life. Ondansetron. Dolasetron prolongs the QT interval, and palanesetron is most potent 5-HT3 blocker and it has longest half-life. The use of this 5-HT3 blocker is used as drug of choice in chemotherapy induced nausea and vomiting. It is also used as drug of choice in nausea and vomiting. Then we have D2 blockers. D2 blockers include domperidone. The domperidone is actually drug of choice in levodopa induced nausea and vomiting. Then we have the one more drug which is metoclopramide. So D2 blockers include domperidone and metoclopramide. Then we have Nk1 blockers or substance P blockers. So these Nk1 blockers or substance P blockers, these are metabolized by CYP like aprepitant and rolapitant, and these are released on cancer cell lysis. And we also have netupitant. So these aprepitant, rolapitant and nepropitant, these are actually the drug of choice for cisplatin induced delayed vomiting. In cisplatin induced delayed vomiting, these are the drug of choice. Cisplatin induced delayed vomiting can cause two main things. One, vomiting can occur within 24 hours, which is 5-HT3 blocker, or it can occur more than 2 days, that is Nk1 blocker. So one more important thing is this netupitant can cause acute and delayed vomiting along with polanosetron. It can cause acute and delayed vomiting along with polanosetron. Then we also have aprepitant. Aprepitant can be metabolized by CYP inhibitors. Aprepitant can also be metabolized by CYP inhibitors. So these are the important points about Nk1 receptor blockers. So the vomiting treatment, the main important thing is we have 5 different types of blockers: acetylcholine blockers, HT1 blockers, acetylcholine blockers, that is hyoscine and scopolamine, H1 blockers, that is doxylamine, 5-HT3 blockers, that is ondansetron, granisetron and dolasetron, D2 blockers like domperidone, Nk1 blockers are substance P blockers like aprepitant and rolapitant and netupitant. Thank you for watching.